Good morning, everybody. It's lovely to see you. I'm sorry that this conference is taking place on about the third day of summer. It is a rather unfortunate coincidence, but I hope you'll all be so impressed by the program and the presentations that you'll forget that it's beautifully sunny out there. I want to introduce myself. My name's Jenny Gray. I'm from Child and Family Training, and I'm current president of the International Society of Child Abuse and Neglect. I'm absolutely delighted to welcome you all to this very important conference, which signals the official beginning of the DFE-funded Child and Family Childhood Neglect project. This is one of a number of projects that's funded currently by the Department for Education, which were commissioned earlier this year. And you're going to hear later on this afternoon a presentation from the Anna Freud Centre, which is another of the projects. We've got an extremely impressive lineup of speakers, and I'm very pleased that they have all agreed and are available to speak today. But before we begin with the programme proper, I've just got a few kind of housekeeping announcements, please. In the interests of keeping to the programme, when we are slightly late, so I'll try and catch up time, be really grateful if speakers could all keep to their allotted time slots. Carla down here is going to be your timekeeper, and she's very ruthless about timekeeping. But there will be some time, sort of 5 to 10 minutes at the end of each presentation as we go through the day to allow people some Q&A. The researchers will also be here during the day, and I'm sure we'll be delighted to speak to you during the breaks. In terms of the fire arrangements, if you could please use the exits that are signed in the lecture theatre or go out through the main entrance, which I presume is where you came in. Go past the ICH entrance and gather next to the building along Guildford Street, which is the street just in front of us. I'm also assuming that a number of people will have already found the toilets, but they're on both this floor in the Winter Garden and also downstairs on the ground floor. There will be 4 catering stations, and we hope that enables everybody to get through in good time. There'll be 2 in the Winter Gardens on this level and 2 on the balcony. You've got a very, very full delegate pack, which we hope will be extremely useful to you, not only to guide you through the day, but also to continue to refer to and to share with colleagues when you leave here. As well as the presentations and papers related to the presentations today, there is also information and application forms to attend regional briefing seminars in the autumn, which relate to the Child and Family Training grant-funded project on childhood neglect. There's also information about a course in Liverpool, which is commencing in September, Giving Children a Voice, direct work with children using the In My Shoes interview. And this is a computer-assisted interview with children and vulnerable adults. If people are interested in learning more about doing direct work, it's a very important resource. And there's also information about this much, an iPad app, been very trendy here, recently developed by Child and Family Training, which enables health, education, social care and other professionals working with children to survey, explore and quantify almost any experience or symptom of children. So in terms of new technology, I think a really important move forward. The PowerPoints from today will be up on the Child and Family website. And I hope that you will all complete your evaluation sheets, which are in your pack, and hand them in at the end of today. It's really important to get feedback from everybody for events such as these to ensure that future events meet your particular learning and development needs. So I'd be grateful if you could return those to the registration desk at the end of the day. So now just moving on to the main programme. First of all, because I'm the president of ISPCAN, I don't ever lose an opportunity for a bit of free publicity. And I just wanted to invite you, if you haven't already signed up, to come to the European Conference, which is being held in Dublin in September this year. I know a number of people in the audience are, in fact, presenting at that conference, but we are really hoping for a very, very good representation from across the UK as well as Europe. And that's the website address if you want to go in and look at the programme and also to register. Now moving on and more to think about the context for today, neglect being a really, really important area for all of us who work with children and families in the area of child maltreatment. And this slide really summarises, I think, a very helpful way of thinking about different types of unresponsive care, and in particular looks at the interaction between children and their parents or caregivers, which it describes as the serve and return interaction. And when I was rereading the article at the weekend that lies behind this slide, I thought it was very apt, given that we've just had the Wimbledon stunning final, that we can think about the interactions between children and their parents very much as the kind of volleying that goes on between tennis players. And we know only too well what happens when people take their eye off the ball or run out of energy in terms of how points can change very quickly. Well, similarly, in terms of children's needs, really important that parents are being responsive to the needs of their children. So there are these four different types of unresponsive care. The first, intermittent diminished attention in an otherwise responsive environment. This can be growth promoting under caring conditions, and no intervention is needed. And I'm sure probably all of us as parents will recognise that we have occasional lapses when we're thinking we're not doing as well as we should. The second is in relation to chronic understimulation, and I think this is a really big issue that practitioners are often faced with. Ongoing diminished levels of child-focused responsiveness and developmental enrichment. And we need to be clear that this often leads to developmental delays, may be caused by a variety of different factors. Interventions that address the needs of caregivers combined with access to high quality early care and education for children can be effective. And as we move through the programme today, we're going to be looking at evidence-based effective interventions. And then thinking much more in the sort of realm of children suffering significant harm, where there's significant ongoing absence of serve and return interaction, often associated with failure to provide for children's basic needs. Now, we know from our practice that this has a wide range of adverse impacts, from significant developmental impairments to immediate threat to children's health or survival. And here, interventions need to assure caregiver responsiveness and address the developmental needs of the child and these are required as soon as possible. And then finally, we have severe neglect in an institutional setting, and this is perhaps most famously been demonstrated through children who were found to be in orphanages, such as those, for example, in Romania, which were researched quite extensively at the time, where children are kept in warehouse conditions with many children, few caregivers, and no individualised adult-child relationships that are reliably responsive. Here, children's basic survival needs may be met, but the lack of individualised adult responsiveness can lead to severe impairments in cognitive, physical and psychosocial development. And essentially, intervention needs to include removal to a stable, caring and socially responsive environment, which is required as soon as possible. And I think these four different types of unresponsive care provide us with a framework for thinking as we move through today's programme. Why is neglect so important? In terms of the latest available statistics from the Department for Education, in terms of children who are the subject of a child protection plan, neglect is the highest category for which children become the subject of a plan, 41.9%. This is consistent finding over many years of keeping statistics, and interestingly, it's also a consistent finding internationally, where neglect tops the reasons why children are the subject of statutory intervention. doesn't always get the publicity it requires, and I think that's really important as we move into this phase of a specific project funded on looking at neglect, to really think about how we can make best use of the wealth of knowledge that's available to us about what makes for effective interventions where children are being neglected. This project that we are signalling the inauguration of today was funded by the Department for Education. It's a 2-year project on childhood neglect, and the aim is to support and sustain the implementation of evidence-based practice through multi-agency training to identify and respond to signs of neglect. Part of this work is to disseminate the existing published research, and that's why we've got so many distinguished speakers today who've taken part of the research that was commissioned through the Safeguarding Children Research Initiative, and also the training materials that were developed by the University of Stirling and Action for Children and are on the DFE website. So part of that work is to think about how to make the materials available in kind of digestible, bite-sized chunks. Looking at the development of multi-agency training on assessment and importantly on analysis, another area where we know that more needs to be done, and supervision and support and training for agency-based trainers. And then looking at the development of a manual and training on modular systemic evidence-based interventions in the field of childhood neglect for frontline practitioners. And this afternoon, Dr. Arne Bentevam is going to speak about the important work that he's been doing with a number of other colleagues to bring this project to fruition, to think about how we can use our knowledge and skills to skill up staff working in this area. By way of background to a number of the different presentations today, some of you will be very familiar, but following on from the Victoria Climbié inquiry, the government commissioned a major Safeguarding Children research initiative to provide us with a better evidence base. And one of the areas it was to focus on was neglect along with emotional abuse. There were 15 studies in this particular program, and they were all brought together in an overview report that was prepared by Carolyn Davis and Harriet Ward. And Harriet you're going to hear from later today. And there will be an opportunity through the bookstore, which will be operating later in the morning and through morning break and into lunch, to purchase some of these publications from Jessica Kingsley, if you so wish. They're also available on the DFE website. So in terms of structuring the program, we're looking in the morning at recognition and response, and I won't go through that in detail, but we'll come to each speaker in turn. And then this afternoon, thinking more specifically around prevention from primary to tertiary level, and following on the theme of prevention from last year's conference that was held by Child and Family Training in November, and thinking about how we might intervene in ways that prevent abuse as well as prevent recurrence of abuse. As I've said, there are a number of different resources that are available, so I'd urge you perhaps to, after the conference, have a look and to make use of the materials that are available.